Edo State Governor Senator Monday OKPEBHOLO has flagged off free malaria testing, treatment and distribution of malaria drugs to combat the scourge in the state. Governor OKPEBHOLO was accompanied by his deputy, Right Honorable Dennis Idahosa, Coordinator Office of the First Lady, Edesili Anani, Secretary to the Edo State Government, Barrister Musa Ihilo, Chief of Staff Gani Audu, Permanent Secretaries, Health Officials, partners of the programs, among others. BTV News Best Orator has the details.
Governor Monday OKPEBHOLO said malaria is a major health challenge and his administration is determined to eliminate the disease in the state, just like Algeria, Ivory Coast and Mauritius have done. The governor said the support from the Islamic Development Bank will help his administration achieve that in alliance with the commitment of his administration to affordable healthcare services in the state. He added that over the next 2 years, his administration aims to ensure 80% of pregnant women in the state receive malaria prevention kits and treatment, and noted that 95% of people in the state will benefit and also reduce infant death caused by malaria to below 10%.
Our goal is to eliminate malaria in Edo State. This support from Islamic Development Bank will help us achieve that, and with my commitment to affordable healthcare. Over the next 2 years, we aim to ensure 80% of pregnant women receive malaria prevention medication. 2, 95% of the people with fever for malaria. 3, reduce infant death caused by malaria to below 10%. To make this happen, malaria testing and treatment will be free at all government hospitals.
Governor OKPEBHOLO said to make this happen, his administration is making malaria testing and treatment free in all government hospitals across the state. He said his administration will, however, need everyone's support. While free testing and treatment are in place, there is need to raise awareness, which he said is key, and they will run campaigns to ensure everyone is aware of the services, and said that anyone caught charging for the free service will be dealt with accordingly. He also thanked the President of Nigeria, Bola Ahmed Tinubu, for his commitment to better health care.
I sincerely appreciate Mr. President Asewaju Bola Ahmed Tinubu, GCFR, for his commitment to better health care. The Islamic Development Bank for its funding and support. The Federal Ministry of Health for its guidance. With our combined effort, we will achieve a malaria-free Edo State.
Coordinator Office of the First Lady, Edesili Anani OKPEBHOLO, commended Governor Monday OKPEBHOLO's led administration for taking the laudable step in ensuring the people enjoy good health care. She noted that as easy and simple as malaria appears, it is deadly, even as statistics show that 30% of citizens of the state are exposed to it, adding that the state has taken steps to fight and drastically reduced it.
To our women, we're saying embrace this initiative. We're saying that malaria affects more women and children. We're here to make sure that our children live healthy. So we say what the government has done today with the partners, it's a good initiative. Embrace it. Mosquito nets, keep your surrounding clean. We have the malaria testing kits. Once you feel the symptoms of, well, fever, sometimes it's not malaria. Just go for the testing. It's free. And we'll emphasize, it should not be sold.
The Commissioner for Health, Dr. Cyril Shomole, said the program is all about free malaria testing and treatment, which is sponsored by the Islamic Development Bank. According to him, for the next 2 years, all government hospitals in the state will receive patients for malaria and they will be tested and treated free of charge, warning that no health workers should be charged for the service. On her part, Director General of Edo State Health Insurance Commission, Mrs. Augusta Ikbia Enaholo, said the commission is in alliance with the program, ensuring every Edo State citizen is given affordable and free access to malaria medication.
Free malaria treatment and testing sponsored by Islamic Development Bank. For the next 2 years, all government hospitals in the Edo states will receive patients and treat them for malaria and testing free of charge. No health worker should charge any patient for malaria treatment and testing, at least for this first phase, for the next 2 years.
The mission for this program is to ensure that every Edo State resident is giving affordable and free access to malaria medication. This is a pandemic, and the governor has spoken that he's mandated to ensure that everybody in Edo State is free from malaria, and it's going to be free of charge.
She noted that malaria is a pandemic and the government has shown that its administration is ready and has taken steps in ensuring that the disease is eliminated from the state. Best Orator reporting for BTV News.